If you've turned 50 and suddenly feel like your neck aged faster than your face, you're not imagining it. This is one of the most common concerns I hear. Patients will say, my face looks okay, but my neck gives me away. In photos from the side, that's all I see. I don't recognize my profile anymore. There's usually frustration in their voice because the change feels sudden. The neck is often the first area to show aging after age 50. And there are real anatomical reasons for that. This isn't just perception, it's biology. Let's break it down in a way that makes sense. First, the skin of the neck is thinner than the skin of the cheeks. It has fewer glands, it produces less natural moisture, it's exposed to the sun for decades, and it simply doesn't have the same structural support as mid-face skin. The truth is, we also don't wear sunscreen and protect our necks as much as we do the rest of our face. That alone makes it more vulnerable. But here's what surprises people. The biggest changes in the neck are usually not just skin related. Neck aging is usually structural, not just skin deep. Underneath the skin is a thin sheet, a muscle we call the platysma. If I say, show me your lower teeth, it's the platysma muscle in our neck, this big broad, thin muscle that is activated. When you're young, that muscle lies flat and smooth under the skin. Over time, that muscle begins to separate from the midline. That separation is what we create vertical banding. You'll often notice it when you talk, smile, or tense your jaw. Patients will say, I see these cords when I look in the mirror, or it looks tight when I flex my neck. That's platysma banding. And that's not something a cream or serum can correct. Platysma banding is a muscle issue, not a skincare issue. Now let's talk about descent. As we age, the supportive ligaments that anchor the face begin to loosen. The jaw softens, the tissue under the chin shifts, the angle between the jaw and the neck become less defined, all these wonderful things. Patients often assume that this is weight gain. But many people will tell me my weight hasn't changed, or perhaps they've even lost weight. That's because this isn't necessarily fat accumulation. It's repositioning of existing tissue. The neck can look heavier even without weight gain. This is where confusion begins. Most patients try non-surgical treatments first: laser, radiofrequency, microneedling, fillers, skin tightening devices, threads. And those treatments can absolutely improve skin texture. They can also help with crepiness, fine wrinkling, pigmentation, but they do not reposition muscle. They do not restore the structural contour. Skin treatments improve quality. They do not restore contour. Let me give you a very typical example. A woman in her early 50s came in and said, I spent thousands trying to fix my neck. Her skin actually looked pretty good. The issue was early structural descent and platysma separation. She wasn't doing the wrong treatments. She was getting the wrong layer. If you treat the wrong layer, the result won't match the effort. Now here's something reassuring. Not every neck concern requires surgery. The issue is primarily crepiness or pigmentation. Laser can be effective, or skincare products, peels, etc. If there's mild laxity and no banding, conservative approaches can buy time. But when vertical banding and contour losses are clearly present, structural repositioning becomes the predictable solution. The best neck results restore definition, not tightness. We are not trying to pull the neck flat. We are restoring the natural angle between the jawline and the neck. That crisp contour that used to be there. Now let's talk about a question I often hear. Can I fix just my neck? Yes, sometimes. But often the jawline and neck age together. If you tighten the neck but ignore jowls, the balance may look off. The jawline and neck are connected. They often need to be treated together. We used to call these neck lifts or cheek lifts or mid-face lifts. The truth is, the tissue from the neck, that platysma, once we make that incision, we elevate the skin. There's that area we call the SMAS. That SMAS invests the platysma, these thin muscles. And so as we elevate that, we're fixing the problem in the neck, the jawline, the jowl, and the fold. So all this is coming up as a unit. This is why evaluation is critical. Now let's address something emotional. Patients often tell me, I feel confident from the front, but I hate my profile. That profile concern can affect posture. It can affect how you feel in photos. It can affect how you show up socially. The goal is alignment between how you feel and how you look. Neck rejuvenation in your 50s is usually about refinement, not dramatic transformation. restoring contour, softening banding, maintaining natural identity. Now let's talk honestly about recovery. Neck swelling behaves similarly to facelift swelling. It peaks early, it softens gradually, it refines over weeks. Neck contour refines over weeks, not days. In the first couple of weeks, the neck may feel firm. Some areas may even look uneven due to swelling. That's normal. By 6 weeks, contour is noticeably improved. By 3 months, refinement is clear. And by 6 months, the results look natural and settled. Another common concern is scarring. Neck-related incisions are typically placed behind the ear and along the natural creases. So post-auricular, we call it. Sometimes an incision right underneath we call it the submental crease. We all have a little incision there. Many of us have a scar there from falling as a child, I hear. That's what we see a lot of. When deeper layers are carrying tension properly, scars heal very well in most patients. Tension is the enemy of beautiful scars. This is another reason technique matters. Now here's something important to understand. The neck ages differently than the face. You can have beautiful skin on your cheeks and still have structural descent in your neck. That disconnect is common. The neck often reveals aging before the midface does. If you're noticing neck changes and unsure whether or not your issue is skin quality or structural descent, that's exactly what consultation is for. We evaluate skin thickness, muscle activity, jawline position, submental fullness, your goals, your comfort level. We offer both in-person virtual consultations nationwide. Many of our patients travel to Cincinnati specifically for facial and neck rejuvenation. When diagnosis matches anatomy, the plan makes sense. And when the plan makes sense, the results feel natural. Your neck doesn't have to give you away, it just needs the right approach.